Elena is 34 years old. She has had type 1 diabetes since she was 11. She did not choose this. She cannot manage it with diet or exercise. She needs insulin every day to stay alive. Every month, Elena spends $450 on insulin. That is $5,400 a year. That is what it costs her to be alive in the United States. Across the border in Canada, the same vial of insulin, same molecule, same manufacturer, same factory, costs $35, not $35 less, $35. Elena is not uninsured. She has insurance through her school district. She is not irresponsible with her health. She monitors her levels 4 times a day. She is doing everything right. The price is still $450 a month. The United States pays more for prescription drugs than any other developed country on Earth. Not slightly more, not twice as much. For brand-name drugs, Americans pay on average 3 times what people in comparable countries pay. For insulin specifically, 10 times. This is not an accident. This is not the cost of innovation. This is the result of a system that was built. Law by law, ruling by ruling, lobbying dollar by lobbying dollar, to ensure it could never be any other way. In 1984, Congress passed the Hatch-Waxman Act. The stated goal was good: create a pathway for generic drugs, so that once a patent expired, cheaper versions could enter the market. It worked for a while. Then the pharmaceutical industry studied the law very carefully, and they found the seams. A drug patent lasts 20 years, but a company can file additional patents on a new formulation, a new delivery device, a new dosage strength, even on the color of a pill coating. Each new patent resets the clock. This is called evergreening. It is not illegal. It wasn't intended. But it is extremely profitable. Between 2005 and 2015, 78% of drugs that received new patents were not new drugs. They were existing drugs with minor modifications. Modifications whose only meaningful purpose was to extend the patent and delay generic competition. The clearest example: Humira. AbbVie's rheumatoid arthritis drug was the best-selling drug in the world for over a decade. Its original patent expired in 2016. AbbVie had filed over 130 additional patents around it. Biosimilar competitors, essentially generic versions, were kept out of the United States market until 2023, 7 years past expiration. The cost to the healthcare system, an estimated $7.6 billion. And to ensure Congress never closed the loophole, the pharmaceutical industry spent over $400 million. Lobbying Washington last year alone. That is more than the defense industry, more than oil and gas, more than any other sector in the American economy. Let me make this concrete. Elena is a 4th-grade teacher in Ohio. She earns $52,000 a year. After taxes, rent, and basic expenses, the $450 she spends on insulin every month is not an inconvenience. It is a decision. It means less in her emergency fund. It means the car repair goes on a credit card. It means retirement contributions get paused when hours are cut. She has looked into ordering from Canada. The price difference would save her over $400 a month. Technically, importing prescription drugs for personal use exists in a legal gray area. The FDA has the authority to block it, though enforcement has been inconsistent. Elena has not done it. She is a public school teacher. She cannot afford the risk. Now consider what changes if the price aligns with Canada. At $35 a month instead of $450, Elena saves $415 every month. Over 10 years, that is nearly $50,000. Money that could have gone toward a down payment, a retirement account, an emergency fund. The insulin does not change. The molecule does not change. Only the system that prices it. Yale researchers calculated that if the United States aligned its drug prices with comparable nations, Americans would save $184 billion every year. Not over a decade, every single year. That is $184 billion that currently flows, from patients to shareholders. Here is the argument you will hear. American drug prices are high because American companies fund the research that creates new drugs. If we cap prices, innovation stops. The rest of the world free rides on American patients. You are paying for the future of medicine. It is a compelling argument. It is also not accurate. A study published in the Proceedings of the National Academy of Sciences found that every single one of the 210 drugs approved by the FDA between 2010 and 2016 had received funding from the National Institutes of Health. Public money, taxpayer money, at some point in their development. Total public investment, $100 billion. The drugs were then licensed to private companies who set the prices. The public funded the research. The public paid again at the pharmacy. Meanwhile, the 10 largest pharmaceutical companies spent more on stock buybacks and dividends last year than on research and development. The money is not going into new drugs. It is going back to shareholders. This is not a story about innovation. It is a story about who gets to own what the public already paid to build. If this is the first time anyone has laid this out clearly, subscribe, because this channel exists to show you exactly how these systems work and what it means for your financial life. 3 things worth knowing right now. First, the Inflation Reduction Act's drug pricing provisions took effect in 2026 for 10 medications. The first time Medicare has ever been allowed to negotiate drug prices. The savings are real, but limited to 10 drugs. The fight over expanding that list is ongoing. Second, if you or someone you know is rationing medication because of cost, most manufacturers have patient assistance programs that are rarely advertised and frequently underused. Eli Lilly, Novo Nordisk, and Sanofi capped insulin at $35 a month for their own programs after public pressure in 2023. That cap applies if you ask. It does not apply automatically. Third, understand what you are being told. When someone says drug prices reflect the cost of innovation, look up who funded the underlying research. In most cases, you already paid for it once. A Canadian with the same diagnosis will spend $3,500 is not the price of her health. It is the price of the system she was born into.